Lucy,
Yeah, what's up?
what is that?
Oh, this? It's my medication.
No, yeah, I figured it was medication. I mean, like, what is it?
We could get technical. Brand name is called Emgality, but the generic name is galcanezumab, GNLM. And the therapeutic class for it is that it's an anti-migraine medication, and then the pharmacological class is that it's actually a CGRP inhibitor. So the way that it works is pretty interesting. It's actually a humanized monoclonal antibody. And so basically, there's this thing in our bodies called the calcitonin gene-related peptide. And what's thought to happen is that the calcitonin gene-related peptide plays a role in migraine. So basically, this will cause vasodilation to the blood vessels in the brain. So because of that, the vasodilation causes pain and migraine. When you have too much of this CGRP in your brain, then that's what causes the migraine. So what Emgality does, or the CGRP inhibitor, what it does is that it binds to the CGRP to inactivate it, and so then that way it can't bind to the receptor.
Oh. Okay.
The drug is fairly new, so there's not a ton of information on its pharmacokinetics, but we do know that it is a subcutaneous injection and the absorption doesn't differ based on which subcutaneous injection site you use. So the normal dosage of it is 120 milligrams per milliliter, but the first dose needs a loading dose of 240 milligrams per milliliter. The drug itself takes 5 days to reach its maximum concentration. What I found to be pretty interesting about it is that the way that it's metabolized is thought to be similar to the way that we metabolize and eliminate endogenous IgG. So it's thought to be broken down into small peptides and amino acids the same way that we break down our own endogenous IgG. And we know that the elimination half-life is 27 days for this drug. There aren't any significant interactions known, but we do know that it should be advised to not use it during pregnancy, and that if you have a hypersensitivity to galcanezumab or any of its ingredients, you don't want to use it. But as of right now, we don't think it has any significant interactions with any other drugs. Most common adverse effect would just be an injection site reaction, but it should be known that you shouldn't use it or continue to use it if you have any hypersensitive reactions to the drug. So let's look at it. So it actually comes in these pre-filled syringes or pens. And a big nursing intervention would just be to teach the patient how to use it before, because it is administered by yourself at home, so you need to know the proper technique for it, as well as teaching them all the precautions that are involved with the drug and any adverse reactions that they should know to report. When the patient administers it, they do it as a subcutaneous injection. So this means anywhere like the upper thigh, the abdomen, or the back of the arms. I prefer the upper thigh. The nurse should tell the patient not to inject it anywhere that is tender, red, hard, or bruised, and that if they are doing the loading dose, to make sure to do it in 2 separate places, because the pens only come in 120 milligrams per milliliter, so that means they'd be doing 2, and they shouldn't be doing them in the same spot. The patient should also be informed about what aseptic technique is, because it is supposed to be used with aseptic technique. The pen itself needs to be kept out of direct sunlight, it shouldn't be shaken, it should not be warmed in anything like the microwave, and it should be stored in the fridge until you're ready to use it. When you are ready to use it, you take it out and leave it on the counter or anywhere where it can remain out of the sunlight but at room temperature for 30 minutes before using it. The drug itself should be clear, and the nurse should tell the patient and make sure that they know that if it's not clear or if they see any visible particles, to not use the drug. And of course, the nurse needs to teach the patient how to actually administer the drug. It's fairly simple, and the actual pen is pretty user-friendly. On it, it has a lock, so you know if it's locked or unlocked, which obviously you use it when it's unlocked. And then you just place it up against the skin at the subcutaneous injection site, and you just press the button. Also, really, really important is that the nurse needs to inform the patient that this cannot go in the garbage. You have to throw it out in a Sharps container. So did that answer your question about what's on the counter?
Thank you for all that. Remind me to never ask you again what's sitting on the counter, because not all of us are nursing majors, and I would just have a lot of information.